Okay, welcome to part one. We're going to go over some general information about degeneration. I like this quote here. I think this is a really, it's a really just an interesting quote. It says, "Everyone knows a cancer survivor, but no one knows an Alzheimer's survivor." So the whole point of this is, Alzheimer's disease, memory problems are very slow, degenerative conditions, and no one knows an Alzheimer's survivor. And the current medical research shows is that people don't actually have to get Alzheimer's disease as long as you know what to do to prevent it. So if you're out there and you have mild cognitive impairment, you feel that you're getting some of these symptoms of your brain not functioning optimally, I want to let you know that there is help out there to reverse these conditions. Now, this comes from the Alzheimer's Association. This comes from their website. And this is a current statement on their page. It says, currently there is no cure for Alzheimer's disease. No cure. Now, I'm going to show you this here. This comes from Bredesen, and he's a medical doctor. This book's on Amazon, and it has lots of reviews. It's The End of Alzheimer's Disease, the first program to prevent and reverse cognitive decline. So through his functional medicine research, he is actually shown clinically that you can prevent and reverse cognitive decline such as Alzheimer's disease. Let me just state here. Let me say this clearly as I can. This is coming from Dr. Bredesen. Alzheimer's disease can be prevented, and in many cases its associated cognitive decline can be reversed. So here's the thing. What are they dealing with here? The only solution they have right here for people are what? Drugs. Okay? What are we doing here? Dr. Bredesen is coming at it from a functional medicine viewpoint. So what is functional medicine? I'll dive into this as we go through this series. Functional medicine is an individualized, custom-tailored plan that fits your needs. So when we look at functional medicine, what it is, it's not a monotherapy. It's not one approach. It's not like here's one drug, here's one nutrient. It's a poly approach. So we're taking many different approaches to figure out what's going on with your body so we can get you well. So what I want you to just look at here, these are healthy cells. So you can see here, so this is the neuron right here, and then these right here, these little things right here, those are like the arms of the neuron. Now, what's happening in here, you can see this is the Alzheimer's disease. This is the neuron. Then what happened is these plaques, these are the plaques that start to form. And when the plaques start to form, it basically, just imagine your hand, like this would be your palm right here, or what, this would be your palm right here, and these would be your fingers, right? So what happens is when you start to get these plaques, these plaques start to build up, and it actually affects the arms on the neurons, and then these arms cannot communicate to other neurons. So how neurons actually survive is there's communication that goes back and forth. It's a two-way street. So it's a two-way street. So here, what's happening is what the research is showing is when people start to develop plaques, this is actually a protective mechanism. So what I want to say again, that's actually a protective mechanism based on Dr. Bredesen's research. These plaques here are actually protective. So the whole goal of this series is to stop neuronal death and improve neuron branching. So what I mean by that is you can see here, like this is actually starting to die. So we want to stop neuronal death, and then what do we want to do? We want to improve neuron branching. So right over here is a video, and what you're going to see right here, this is a dead neuron. This one is going to be dead, and this is alive. And what you're going to see on the video here is you're going to see how this neuron can actually start to what we call, there's kind of a term here, it's called neuroplasticity. What that means is that you can actually grow your fingers just like on your hand. Your fingers can actually get longer and start to grow. So what we want to do is we want to stop neuronal death, and then we want to improve branching right here. So let's play this video so you can see this and what's actually happening here. Okay, so now you can see the picture here. Okay, I'm just going to pause it. Oops, geez, sorry. Let's just play it again. Okay, so you can see what's happening. You see how the branches are starting to branch off on the one that's alive. And you can see how those fingers are actually starting to grow. So what we can do on a functional medicine level here is we can actually start to grow these neurons right here. Let me just put on pause. So these neurons right here that are actually starting to grow right here, we can make these things grow. You see how it started off as a little bud right there, but that neuron was alive. That's the key thing. It was alive. So then this is what we call neuroplasticity. So if we have, this is that dead neuron right there, right? So what we can do is we can have these neurons, right? The arms, the fingers of the neurons grow to another neuron right here and give that nutrients. Because remember, the nutrients, they communicate back and forth. This communication happens back and forth. So if this one is alive right here, if this one's alive, it can bypass this dead one and go to another live one and give this other live one nutrients. So our whole goal is we want to stop neuron death. So we have to figure out why these neurons are dying, which is due to inflammation. And then from there, then we need to improve the branching, where you can actually improve the branching and get your fingers start to grow longer. And then they can start to reconnect to other neurons and start communicating at a higher level. So this is the whole goal, the whole theme of what we're going to try and do is stop neuronal death, and we're going to start to improve neuronal branching. So let me just continue this video here. So you can just see how it continues, those arms continue to get longer and longer. Okay, so this comes from Dr. Bredesen's book. So Bredesen's book right here. So here is the perfect Alzheimer's drug would have to do all these things, right? So all these things, the perfect Alzheimer's disease drug would have to do. So there is no drug on the planet. There's never going to be a drug on the planet. This is why when it comes to Alzheimer's disease and cognitive impairment, mild cognitive impairment, dementia, Parkinson's disease, that it's been an utter failure because there's no one solution there's no one drug. What we want to do is we want to take a polytherapy approach, and as we walk through this series here, you're going to understand what a functional medicine approach looks like. So what we want to do is how we want to approach your case here is we want to do a systems biology approach. So what does this mean? This means that we're looking at you as Mary, Bill, Jim, Ann, Jackie. We're looking at you as an individual person, and instead of just having one approach, right, what we're going to do is these would be all the different approaches, right? These little arrows would represent all the different things that we're doing on a functional level basis to get you better, which is called a systems biology approach, versus one isolated nutrient or an isolated drug. That is not going to work in the current system. We want a systems biology approach, which means looking at you as a whole entire human being, figuring out why your body's not working right, and then from there, once we figure out what's working right, then we can give you the nutrients that God designed your body to have so you can start to function and start to heal and function at a much higher level. So here, if you want to read the definition of this is what the definition of a systems biology approach is. So in the workshop, we're going to be covering 3 basic common neurodegenerative diseases. The first thing is dementia. This is where most people are going to be sitting right here. There's Parkinsonism, which is you feel like you're getting slow movement. You have poor GI motility. This is a key one, people, is decreased smell and decreased taste. This is critical. And then we have the cerebellar degeneration, which is by the back of your head. And this is really important for older people because worsening balance, worsening coordination, you bump into everything, dizziness and disorientation. What are the older people usually afraid of? They're falling and what? You're going to break a hip, right? Because everyone knows once you break a hip, what happens? It's not good. So worsening balance. So these are the 3 common neurodegenerative changes. We're going to start with dementia. Now what happens with dementia is the first thing you have is what we call mild cognitive impairment. And all these things here would indicate that you have mild cognitive impairment or dementia. You're forgetting things, forgetting dates, appointments, you don't know where you put your keys, your wallet. Memory lapses, you can't remember the conversation you had like 5 minutes ago, an hour ago, or yesterday, and you forget locations. Now, all of these things here, the common symptoms that people will have is this right here. They'll be depressed. They'll have difficulty concentrating. So, for example, if you used to be able to read for a long period of time, but now you can't concentrate for a long period of time, that tells you that you have some kind of brain problem, that your brain is starting to neurodegenerate. It's not starting to fire correctly. If you can't concentrate for a long period of time, if you get brain fog, if you lose focus and attention, your memory's just not working right. These are all the early signs, right? This is the key, the early signs that your brain's not functioning correctly. So here's what happens. I just want you to take a look at these brains. So this is, you can see this is a normal brain, and you want to see how tight like the brain matter is. And then you can see here as someone starts to degenerate, you can see how there's big spacing in here. Now this right here, when you see this big spacing, that's neurodegeneration. So what does that look like here? Let me just back up a couple slides. So that's right here. Right, so when this neuron starts to die, your brain starts to shrink. That's what we call neurodegeneration. Or right here, this is starting to shrink. It's not as healthy as these normal healthy neurons. So what happens in the brain, you can see, for example, why I brought this in is you can see back here, this is fairly tight. This is this back here, this part of the brain as well. Then over here, you can see how there's more gaps right here. Let me just change my pen. You can see here how there's more gaps in there where it's really tight in here. So this right here would be normal, right? And then right here, this is starting to get what we call neurodegeneration. Same thing with here. You see how this part of the brain is nice and tight, and then you can see here how it's starting to neurodegenerate, and down here starting to neurodegenerate as well. So why is that so critical? Because different parts of your brain do different things. So if we can isolate, which we can do, we can isolate where your brain's not functioning correctly, then we can go in there and then we can specifically start to rehab and start to give you exercises and specific nutrients that are going to help that certain type of area of the brain. Because different parts of your brain do different things. So for example, here's, this is what we call your cerebellum right here. Okay, now I'm just going to back up a couple slides. This is what we're talking about here. Remember when we talk about this, your cerebellum, which is the back of your head, it has to do with balance and coordination things. So you can see how here this is nice and tight. That's normal, healthy brain. Now what's happening here? Right, you see how there's gaps in there? Your brain, this portion is starting to what we call neurodegenerate. Now the question is, why is it starting to neurodegenerate? And we'll be answering that throughout the series here and the different parts that we're going to be doing. But so for example, like this is what your cerebellum does, which is what we're talking about right here, is do you have difficulty with balance? So then you just measure this. You just a 0 to 4 scale, right? Do you feel unsteady? Do you feel like you're swinging or you sway one side to the other? Are your hands clumsy? Are your hands, you have clumsy hands, clumsy feet? This all indicates that your cerebellum, which is, this is right here, and this is what you're looking at right here, starting to degenerate. But you can see here how this is just fine, and there's certain parts of your brain that are starting to neurodegenerate. The current functional medicine research shows that you can support this and start to heal this process so you can actually restore some of your brain function. So you can store you can restore some of your brain. Now, why is that? Is remember that little video I showed? This we can start to branch out your hands. Like if this is the neuron right here, this is, I know it's a poor neuron, and then these are the hands, the fingers. We can start to branch these things out, these fingers, into this area and to support that. That is scientifically proven that we can start to do that. Okay, clumsy hands. Now this right here. This is another part of your brain. So this is a 3-part, I think it's 3 pages or 4 pages where we actually check different parts of your brain. Now this has to do with short-term memory. So this is a different part of your brain. Are you having memory problems that affect your daily activities? Are you confused about dates? Are you misplacing things? Are you forgetting names and faces and names? So this tells us here, if this comes out positive, that we know that you have an area of your brain that's called your hippocampus that's a problem. versus, let's say you don't have any of these. Let's say you score like 0 or 1s in there, but in this area right here, what has to do with balance, you're scoring 3 or 4. That tells us like your problem is located in this area versus your hippocampus. So anyway, the reason why I just state that is because now we can actually sit down, have a conversation, do some testing. You can fill out some paperwork where it's going to help us isolate what's going on with your brain. Here's some other one. I did put these in here. This would be the frontal lobe, so this would be right above your eyes. These are all the symptoms that you have if that area of your brain is not working correctly. So there's different areas that we can actually look at and start to support, give your brain exercises. You can actually exercise your brain. That's real critical to start exercising your brain, because when you start exercise your brain, guess what happens here? When you exercise your brain, this is when these little fingers start to grow out, is through exercising your brain. So 1, we need to stop neuronal death. 2, we need to start extending your fingers out so your fingers start to get larger. So if there's a neuron right here, it can start to communicate to that neuron and bypass that dead one that's not living. Because once these things die, once these neurons die, you can't regain those. See, that's the key. So then we have to retrain the ones that you have and make sure that your finger is starting to grow longer. So again, here's just more quizzing to see what's happening. Are you affecting, are shades of color a problem? Are you having problems with hearing? Are your problems having with word comprehension, the spoken word? So all these things we can isolate your brain to see where your brain is not functioning. So that wraps it up for part 1.